And now we move on to a really critical discussion, role of leadership in driving technology adoption in digital-ready hospitals. So this session will explore leadership strategy, governance, clinician adoption, and ROI from digital investment. May I invite our esteemed panelist, Commander Navneet Bali, Executive Director and Group CEO, ClearMedi Healthcare, Dr. Shankar Narang, CEO, Center for Sight, Dr. Saurabh Lal, Vice President and Hospital Director, Marengo Asia Hospitals, Vijay Varghese, Hospital Director, Manipal Hospital, Dr. Sunil Khetarpal, Deputy Director General, AHPI. Let's give a big round of applause, guys. Let, let's welcome them to the stage.
Good afternoon to all. So we are running almost 1 hour late. And we have to leave at 4 to Gurgaon. Commander Bali and many of you sitting here will have to be in Gurgaon for our own event at 5:30. So we'll have a very quick session. I'm sure the panelists will be able to do justice, to this session within the time span which, maybe 15 to 20 minutes we'll spend. Well, once again, a very good afternoon to everyone, and thank you, DHN, for the opportunity for inviting us for this very important topic, the role of leadership in driving technology adoption in digital-ready hospitals. India's digital health market is valued at nearly 18 billion US dollar and growing rapidly. The recent AI summit, AI Impact Summit, which has happened in Delhi, it will give a big boost to the AI market in the country. And now this digital transformation is no longer about isolated IT upgrades. It is about the institutional transformation. So with over 120 hospitals which have been accredited for the digital health standards by NABH, now we are witnessing a structural shift. The leaders are now thinking about the governance, about the interoperability, about the compliance, about the measurable outcomes. Now, even if you see the digital maturity among the key big players, the chain of hospitals, it remains uneven. Even among leading private hospitals, as I mentioned, among their networks, adoption always depends less on the tools, but more on the leadership conviction, cultural readiness, and ability to align clinical priorities with business strategy. So we'll have a discussion on a very critical question, that the role of leadership in driving technology adoption. Now, I don't know, I will ask a question. I'll start by asking a question to the audience. Is digital transformation owned by CIO alone, or by the CEO, the clinical heads, and the board? Yes, please, any CIO who can answer this? No offense to any CIO. Is it only owned by the CIOs? But how do we move from pilot to the enterprise-wide integration? And how do we balance innovation with the DPDP, compliance under the DPDP Act? So, and most importantly, how do we measure, or how do we derive, and how do we measure the real value from the digital innovation? So this is what we are going to discuss today. So I'll just move on to among the panelists. And first question is to Commander Bali. He told me that don't ask me any questions. I have already spoken. So it's always a pleasure to listen to you. Am I audible? Yeah. So first question is to you. As a group CEO, how do you personally anchor the digital transformation at the board and executive level so that it becomes a strategic priority?
Yeah, thank you so much. As I said, I've already spoken today in that HADOC launch of the agentic healthcare system. So I think the three words which summarized whatever I said was about courage, conviction, and cooperation. So as a CEO, I'm very clear where ClearMedi should be heading. In fact, 2027 FY, the strategic guidance for ClearMedi Healthcare is artificial intelligence, both on the non-medical side, which takes care of the inefficiencies in healthcare system. Not only that, also bring in AI big time into our clinical side. And as every one of you must be aware, I don't think there is any doctor in the country today who doesn't use AI. None. Everyone uses it. And the second part of the story is, earlier when the patients used to come to a doctor's clinic and say that I have read it on Google, they would say, you please go home, because please don't come to me, because Google was all over the place. But that's not the question anymore. The patients themselves are uploading their prescriptions, their radiology reports on ChatGPT, on Perplexity, on Gemini, and when they come to the doctors, doctors are not able to say that, because though AI is hallucinating even now, but many of the things that AI is giving output is quite closer to what it should be. So to answer your question, sir, clearly for me, healthcare just not is not possible for healthcare to exist without AI in the future. So I think everything that we do now, everything will be aligned on that journey.
Thank you, Commander Bali. Very well answered. Now I will move on to Dr. Shankar Narang. Dr. Shankar Narang, you are heading one of the very key and the largest chains of eye hospitals in the country, and Center for Sight. So, in a specialty network like ophthalmology, how do you drive the clinical acceptance of EMR, AI-assisted diagnostics, and workflow automation without impacting the consultation time or the patient satisfaction?
Well, you have asked a really difficult question, especially the last part of it. The first and foremost thing, whether it is a single specialty or a multi-specialty, we need to understand the setting in which all this happens. So let's say a OPD chamber or a clinic of a doctor. The three important components of that is, one is doctor-patient interaction, where patient looks for more time of the doctor, attention of the doctor, and he wants doctor to listen to his problems. So how can technology solve that? Or is technology becoming a hindrance in doctor looking at the screen on more than towards the patient? Though it doesn't happen in ophthalmology, because doctor has to look into the eye of the patient. But some other specialties, it might happen that doctor looks more at the screen and less at the patient. So that is one thing where I feel that technology should be an enabler of decreasing the time which doctor spends on the screen. Second, I understand, or how I feel is that technology should help in delivering a better clinical outcome, maybe, or more forms and formats in the technology. So that gives a sense of ownership. Second, making them understand how it is beneficial for them, leave aside administrative side, but more from a clinical point of view, helps in a continuity of care, standardization of care, maybe helps in a lot in research and academics, helps a lot in medical legal purposes, definitely environmental friendly, saves a lot of paper. And once these things are realized, I think the adoption becomes little more easier for the clinicians. Last and not least, definitely, if we are able to create a little bit of healthy competition amongst the clinician and maybe have some reward and recognition, that definitely goes in a long way in adoption of EMR in the clinicians. Having said that, we have started adopting EMR in our own organization around 8 months back, and we are 89% compliant in 8 months. So that's, I would say, a great achievement for our doctors who have done a wonderful job in doing that. But yet, having said that, we have a long way to go. 11% is not the difficult one. We have to understand the two other parameters also. How conversant is the clinician to adopt the technology? At times we need to provide them with some other tools, maybe some other assistants, whether it is a man or another machine which can help them in filling this EMRs on a faster pace. So I will stop over here. Yeah. On the AI part, we'll come later. Maybe we have one round going with everyone, because we are running short of the time.
Your answer is very valid. I think involving, engaging, and empowering clinicians is the key. Without that, you cannot think of digital transformation. Whatever AI or whatever you talk about, you need to involve, you need to engage and empower the physicians, clinicians. Thank you. Now my next question is to Dr. Saurabh Lal. Saurabh Lal, you're the Vice President and Hospital Director, Marengo Asia Hospitals. And you are also responsible for PNL, right? So, from PNL perspective, I'll ask you a question. How do you prioritize technology investments? Number one. And the second part of my question is, what framework helps you decide between expanding clinical capacity versus investing in digital infrastructure? So, over to you.
So thank you so much for that question. It's a very relevant question, and I think uh, a question to be answered before this question is, what are we trying to solve? Because in healthcare today, most of the times we are solving problems using technology, not because we have a problem, but because we have a solution, and we are trying to find a problem for that solution. So my sense is that first we need to answer, is the real problem that we are trying to solve actually the problem we want to solve with technology? If that piece is sorted, technology brings in a lot of advantage. And as a P&L owner, I think one of the largest advantages it brings is it optimizes the cost. It automates processes. It gets us to a point where we need lesser number of people doing that particular job. But one of my favorite examples I give with technology, automation, and AI in healthcare is something called as the Cobra effect. I've spoken about this at multiple forums, and I'll take 30 seconds to explain what it means so that people get to know what what stage we are as far as AI and technology is concerned. So in the British era, Mehrauli area was considered to be a forest which had a lot of cobras. And the British wanted Indians to be incentivized to a stage where they start reducing the population of cobras. So they brought in an incentive scheme where they said that every cobra head that is submitted to the headquarters will be incentivized with an asharfi. Asharfi was a gold coin. Cutting a long story short, over a period of time, what the British government realized is that the number of cobras actually increased by 10x. And when they went into the details of it, they figured that Indians, being an intelligent lot, were rearing cobras in their backyards. So as far as AI is concerned in healthcare, today we really need to understand what we are doing in terms of research and whether we are actually aiming it to a problem, a real problem that exists, and whether we are creating the right incentives for it. So whether it is adoption of technology, whether it is creating new AI models, I think we need to first answer the question on whether my investment is going to solve a real problem, or have we or anybody as an institution invested money in creating a solution and then we are going out finding a problem for it. So I think that's where the real answer lies. To quickly summarize, in my opinion, I'm a great believer in technology. Technology not just saves money, it saves time, it increases efficiency, it reduces the number of people required for a particular job, and there is no doubt about the fact that technology investment is the way forward for successful hospitals.
Good. Thank you, Dr. Sarao. Now my next question is to Vijay Varghese. Vijay Varghese is the hospital director, Manipal Hospital, Dwarka. This is about building a digital-ready culture and building a digital literacy among the senior clinicians and administrators. What does digital-ready culture mean at the hospital leadership level? You as a hospital leader, what does it mean? And to you, and how do you build the digital literacy among senior clinicians and administrators? It's very important, the culture and the literacy.
Thank you, sir. So for me, when I say digital readiness or a culture for digital readiness, is very simply put, it's a mindset, it's an open mindset where the ecosystem of the hospital is ready to integrate technology into the daily workflows so that we can have better patient outcome, better optimization of costs, and operational efficiency. So when we have the mindset is ready to adapt technology, to adopt technology, when the users are ready, I think that is what we say by a digital ready culture. And so when it comes to adoption of technology, so before that I would just take, I was reading somewhere, when the telephone was introduced in the world, the telephone, it took 75 years to reach 50 million users of telephone. But when Facebook came, It took only 3.5 years. And very interestingly, when this Angry Birds, it's a game, when that was, put into the market, it took only 35 days to reach 50 million users mark. So basically, when the whole world, the adaptation, the technology adaptation, or the digital readiness is so global. I mean, when you see it, that is how the population is so ready to adapt digital technology. How can a hospital be behind? Because when we are also operating in the same atmosphere. Just to answer the second part in terms of, how do we make sure that our users, or especially clinicians and others, adapt into technology. From Manipal, I'll just take, I'll take 2 minutes to explain two technologies that we are doing, which is much beyond EMR and, all that is already there. We have a complete paper-like system across Manipal hospitals. Our OPD prescriptions and everything is completely through the system, IPAC and everything is there. I'll just take one example which Manipal has demonstrated. This is along with the Google Cloud. We have developed a certain platform. This is an AI-enabled platform which improves nurses' handoff communication. So we all know that this is very important aspect in ADH, also 6th edition, this is very important, but it is taking a lot of time for the nurses for each shift to ensure that there is a handoff communication happening. So with AI, we have developed, Manipal has developed a technology with the help of Deloitte and also Google Cloud and of course Manipal, the team. This is a technology by which the data is fetched from the track care is our HIS, from the HIS, and it is synthesized into a report which actually in the format of ISBAR communication tool. So it takes only a few minutes for the nurses to prepare the handoff communication, the tool, the document. So then we realized that this has reduced almost 78% of nurses' documentation time, and also when the shift change happens, almost 1.5 hour goes into handing over communication. So this is something that is a very practical technology-enabled solution that Manipal has provided, and we are using it. Almost 5,000 nurses in our ecosystem is using this technology. Just 1 more minute I'll take to answer the adoption by the clinicians when it comes to our technology, or whether it is EMR, whether it is e-prescriptions, whether it is e-pharmacy. So what we do is we have, of course, we go through all the strategies like communication, engagement of doctors, training. But I would emphasize on the last part, that is about monitoring and measuring. I will use the word measuring rather than monitoring. So daily we get a dashboard in terms of what is the OPD prescription adoption by clinicians. So for example, if we have, say, Dr. ABC by name has seen, say, 100 OPD patients on a particular day, say yesterday, how many of the e-prescriptions were generated? So when it is 80 people, so we know that only 80% is the usage, and what happened to the 20%? Where is the challenge? So every day morning we get a dashboard on this. So we can go back and talk to the clinicians, what are the challenges they are facing, and what kind of support systems we can enable to ensure that they are adapting to the technology. So that is how we have been able to get into a almost 100%
Wonderful,
usage of
wonderful. So,
technology in our,
since you have the real-time monitoring, real-time audit of the OPD prescription, so
Yes.
that really creates value and make the doctors more
more
alert.
savvy
Yeah,
and
very good.
usage
I
of
think that's a great step.
technology.
Now I quickly, I'll give 1 minute each to all the panelists for very quick answer, please, because our time is already 4. Dr. Commander Bali, now this, you are operating across multiple units. ClearMedi operates across different geographies. But how do you standardize digital adoption across the units while allowing for the local operational flexibility? How do you standardize? Yeah.
So, I mean, there are some standard things like your HIS, which is absolutely standard across the network. So there is nothing required. There is no local intervention required. Most of the digital initiatives and most of the digital practices are actually common across the network because you need a uniformity. In fact, I would go on to say that we should have a portability across all networks, across everything, so there is nothing, so there's no local intervention at all. So I think almost 100% of whatever digital interventions, almost everything 100% is centrally deployed, and there is no local intervention, there is no local sort of elbow room to do anything at all, Dr. Khetrapal. So it's all completely same uniform digital practices across all the hospitals of Clear Medi. There is nothing like local.
You are addressing the interoperability.
Absolutely, it's all interoperable. It's
That's
absolutely
wonderful.
clearly done. So there is no local elbow room given to anybody. Yeah.
And thank you. Dr. Shankar, AI governance in clinical practice now. Now with, AI increasingly entering the diagnostics, and what governance model do you believe that, hospitals should adopt to ensure accountability, auditability, and ethical usage of the tools?
So, see, our healthcare system is based on three basic virtues, if I have to say: trust, accountability, and so if you really have to put it, it is transparency. So until unless any AI, means AI is everywhere. We have seen last 4 days how AI was even on the roads of Delhi and we were jammed for three hours. If AI doesn't bring these things in healthcare, so I think then that is going to be a big challenge. So we can't leave clinical pathways or algorithms on basis of sub-algorithm. It has to have an oversight of a doctor. I would put simply in two ways. If it is AI is not governed, it can become a huge liability. If it is governed and it is clinically governed, it can become a big enabler. So it has to has all these standards taken care of, especially in our scenario of healthcare delivery.
Wonderful. Dr. Saurabh, this is about, the innovation is moving at a great speed. We know how the innovation is happening. But how do you ensure compliance with the DPDP Act and the medical legal risk management while still maintaining the innovation speed?
So the biggest concept of ownership and risk is when somebody owns the outcomes of a flaw or a fault. Half the time in large institutions, including healthcare institutions, the error, the person who creates the error is eventually not responsible for the fallout. And I think that is where the lack of ownership comes in. So in quick two statements, I think the innovator, the risk taker should also be responsible for the outcomes, good, bad or ugly, and that gives more ownership. Outcomes are not only financial outcomes, they are always, across the board. So I think that is one important piece. As far as the DPDP Act is concerned, and I'll give an example of how I interact with a lot of startups. Everybody is working in silos. The left hand does not know what the right hand is doing. And at the end of the day, the assembly line of processes don't work in the same way as the fundamental assembly line principles, which means that the outcome of the previous step should become the input of, or the output of the last step should become the input of the next steps. That principle has been completely violated as far as technology, AI and automation innovation is concerned. So I think we need to re-bring everybody to the same table and make sure that every step or every research or every innovation that is happening in any organization has a multi-stakeholder approach the way we do with our regular processes. So when regular processes, if there is any other process in a hospital that needs to be put on ground, there is a set of stakeholders. I think that is what needs, that same discipline needs to be brought into the AI innovation system, and that will solve it. It's an auto-correctable problem. It's just about creating the right approach and following the fundamentals of how processes work in organizations.
Thank you. The last question to Vijay about the data-driven decision making. How is the leadership, you as a leader, using the real-time dashboards and the analytics for the operational decisions to make? And has this tangibly improved the patient flow or the revenue cycle?
Of course, because now we cannot imagine running a hospital without the dashboards which we are seeing. Are they stats with dashboards and what kind of, because that the advantage is it synthesizes the data into a very visible, very easily interpretable dashboard, and that helps in each and every decision making, whether it is clinical dashboards which we are using, or whether it is the operational dashboards, whether it is the financial dashboards. I mean, that has become so much part of the life, part of our lives, that each and every decisions are not are governed by this, not by subjectivity, but with objective data and the insights that these kind of dashboards are providing. So I can give many examples, and at each point, starting from, like you asked about patient flow, like we get a dashboard in terms of what was the appointments done and how many patients have availed the service. So we know that there is a kind of a no-show of say around 10 to 20%, and that also with doctor-wise or specialty-wise, so that we get it on a daily basis. So we look into what are the loopholes, why did this patient come back, what can we do, can we call back, can we look into, is it in some internal factors, external factors, is it with the provider, or is it with the hospital, or is it with the patient factors. So we try and act upon it, and so that is how starting from patient flow to taking decisions which are optimizing costs or financial decisions. So everything these dashboards have become
Wonderful.
an integral part of our
Wonderful, wonderful. Dashboards are so important. So thank you. I think thanks to all the esteemed panelists for such a thoughtful and an experience-driven insights. Thank you so much. So the message which I want to give, what has emerged from the discussion now, digital transformation in the hospital is not about software. It is not about software. It is about stewardship. It is about the stewardship, ownership, leadership, governance. So this is what, when we talk of digital transformation, so without leadership and governance, digital transformation cannot happen. Thank you so much, and thank you, DHN. Sorry, we have to cut short, and because of the paucity of time, we have to leave. Thank you so much. Thank you all the panelists.
Thank you everyone. Thank you the speakers.